Facelifts today are vastly different than they used to be. We focused in the past really only on one aspect of facial aging, which is an important aspect, which is the skin. Skin will age, it will get loose, it will stretch, it will sag. When you tighten up facial skin, things improve, but it's very important that we focus on the areas of the face that are also underneath the skin, because that's where a lot of facial aging occurs. And that is at the muscle layer, at the connective tissue layer, the support structures for the skin. So a modern facelift, a facelift of today, focuses on tightening up the infrastructure underneath the skin, removing slack skin also, but not relying on the skin to lift and hold up the face. The optimal results require going in there, tightening up the muscle layer in the neck, the support structures in the cheek areas. Also involves use of fat grafts in the cheek areas around the eyes. So a lot more things than we used to do in the past. And there's a lot of attention to detail in terms of where you hide your scars. Very important to make very precise incisions, follow aesthetic curves around the ears, or inside the ear, behind the ear, and that's what creates a rejuvenated appearance. Some patients will start doing all kinds of things that before they felt they were too old to do. It might be traveling, it might be a new vocation, a new hobby. What you're doing is you're making them feel as good as they possibly can look for their age. It's a realistic patient that does best with this type of surgery.
It feels wonderful. Your self-esteem is, is risen. You just feel good about yourself. You're just open to a lot of different avenues that probably when you're not, you kind of like reserve and hold back and you're like timid and everything else. When you feel good about yourself, you're out there. You're really out there.
It is very fun surgery to do, and the results are really gratifying, and they speak for themselves.